So do you need treatment? Well, I think that's always a huge question. And this is where I probably spend most of my time with my patients, talking to them through this, because it is not an easy yes or no. So the answer is maybe. And, most people, as I mentioned, don't ever need treatment. And we do also say that treatment really depends on location and symptoms. So I will say treatment should be symptom driven. And I think I've mentioned this in my other webinar. And I think hopefully this is a message that you get over and over again. So you really want to think about my symptoms. Are they debilitating? Are they ruining my life? Am I able to function? Am I able to do the things that I enjoy? Are they interfering with activities of daily living? Are they interfering with my job? So those questions, if the answer is yes, they're completely debilitating, then you really need treatment, right? But if it's a small cough and none of the other tests have really gotten to show anything serious, then maybe we just try inhaled steroids instead of putting you on some pills. So there's some things that we can do, and we really do have to have a conversation with you about, hey, treatment's tough. It's not necessarily easy. And so are you sure you want to do this? Let's see if there's something else that we can do first. We will treat, however, if we find sarcoid in the heart, the brain, or the eye, even without symptoms. Okay, so that is something that is important to keep in mind. And like I said, treatment is full of pros and cons. And so we really want to sit there and think about this. So there is a whole webinar by Dr. Raj who talks about all the different therapeutic options, but I just want to kind of touch on them briefly for you here, which is most of the time, 99.9% of the time, treatment is going to start with prednisone, and usually it's about 20 milligrams a day. It can vary up to maybe 40 milligrams, but usually 20 milligrams should suffice. And you want to treat for at least 6 months. And people don't understand this. They're like, oh, but I feel so much better after 2 months. Why do I have to continue it? Or there's unfortunately some doctors that will say, oh, well, you're better, let's stop it, because they don't necessarily know. So that you can be your best advocate by actually really understanding that if we get past 6 months, then we have a higher likelihood of putting you into remission, which is what we want, where it goes to sleep or it goes away completely. And if you don't respond or you start to have complications from our prednisone initially, then that's when we either add or switch to a different medication. And I've listed all of those here because there are quite a number of them. But there is not a single medication on this list, including prednisone, that does not come with a whole lot of side effects or complications that we really need to be thoughtful about. Now, there are plenty of patients who have no choice and have to be on treatment, and they can do just fine. They just have to, it's just another added layer of complexity to their life.